vasectomy method used and known, do you think, in a lot of countries, or is that still not as well known?
I think nose-covered vasectomy is known almost all. So far, I know most of the countries know about it, but maybe due to other challenges, acceptance is not that high. But to me, as I wanted to say that we will have to present the service as a demedicalized service so that people are not intimidated. We should have a welcoming, respectful, clean, nice, colorful setup so that welcome reception is welcome waiting area and not a very intimidating operation theater. We didn't need big operation light or OT light. We didn't need huge anesthesia machine, other equipments with very little minimum thing, but at the same time, we will pay full attention to the infection prevention practices, aseptic technique, and emergency medical management. All steps must be there, but we don't want to see all those big equipment in a homely, small, colorful way, talking continuously with the client. That will distract the client, and with minimum local anesthesia, we can complete the procedure. So that is, I think we need to strengthen our providers, quality training, and provision to practice on the client. Otherwise, they will lose their skill. Cool. So training together with the practices and the medicalized center, I think that is how it can, at the same time, side by side desensitization and advocacy meeting should continue. That also needs huge support from the donor. Otherwise, it is difficult. So I think these are the few steps, few ways forward that you can think about.
We're really out of time, and we have our next speaker and the next session coming up. But it happens to be hosted by Dominic Shattuck, who's, he's a leader in all of this, but also he's representing the International Conference of Family Planning, and that is next year. And that is a great opportunity for us to stand, to really raise the issues. That's what the platform's there. We've got they got their agenda, but we also need to make sure that the agenda includes men, and they, I'm sure, are already doing that. And our job is to make sure we present really good papers and good presentations and make our points really well. But to take us from the next conversation, everybody should stay, because Dominic is he's paying attention to all these things. So Dominic, if you're there, it's now your microphone.
Thanks, Jonathan. I'm part of a collective group, and I think we have someone who's going to lead the session, but we can definitely jump into some of those topics. And I really appreciate the conversation that's been y'all been having, and I'm sure it's been going through the night while I was asleep, and you've been pushing it along. So I think that Beth Frederick is going to take it over at this point and shepherd us through this next few moments.
Hi, Dominic.
Good morning.
Good morning. You're welcome to continue.
No,
it was a great conversation.
Yeah, please go ahead.
I'm also just I'm gonna sign off as I hand over to and just say thank you to the MSI folks and handing over, and thank you, Jonathan, for inviting us to take part.
Of course, yeah, happy to have you guys. Don't everybody let's stick around and let's keep listening. So there you go, Beth. It's your microphone then.
Jonathan, thanks so much, Jonathan.
Take care, guys.
And happy World Vasectomy Day.
Thank you.
Frederick, I'm the Deputy Director of the Bill and Melinda Gates Institute within the Department of Population, Family, and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health. And I am delighted today to represent the Gates Institute on World Vasectomy Day. I'm also the Executive Director of Advanced Family Planning. I wear a lot of hats at Hopkins, and I am very fortunate to be co-hosting this hour with my dear friend, Dr. Moses Mwange. Moses, are you on? Doesn't look like it. We've got a lot of folks joining us, so why don't I introduce some of the others and have them introduce themselves. Peter and Guri, I see you, so why don't you take the first self-introduction?
Thanks, Beth, and thanks, Dominic, for this. And thanks, Jonathan. That was amazing conversation. My name is Peter Ngure. I'm the advocacy advisor for Options Consultancies, but I also lead a community-based think tank called Pathways Policy Institute. And we deal with population health and environment. Family planning is one of our core works. But for this conversation, we are more focused on our incentives for vasectomy in Kenya program. Thank you.
Thanks, Peter. We also have Tom Alude. Tom, you want to introduce yourself and put yourself off mute and on video? I see you there.
Hi guys, my name is Tom Alude. Currently serving as the founder.
Tom, you're going to need to speak up a little or get closer to your mic. We want to hear all your brilliance.
Can you hear me now?
Yes, excellent.
Not any better? Thank you
Yeah,
so much.
that's great.
My name is Tom. I want to join Peter in appreciating the network. It's very informative. I work as a founder and executive director of a community-based organization in Kenya.
Tom, you've still got your microphone problem.
Okay.
Yeah, you got to put it very close to your mouth, I think.
How about now?
Much better. So just keep it
Okay.
there. That's great.
Thank you. As I was saying, I founded a community-based organization here in Kenya called Afya Elimu CPO. Mostly we are focusing on dispelling myths and conceptions around contraception and family planning, access to adolescent girls and young women in the rural community of Kenya, specifically in Siaya County. I'm a freelance plumber, if you might call me that. I get my hands dirty doing plumbing work. I'm currently also working at a North Coast Medical Training College in Kenya as a head of department for health system support management. More about me on Google. Thank you so much. I think that's all for now.
Thanks, Tom. We're also joined by Dominic Shattuck, who was on the prior session. And Dominic, if you could just you've probably done this already before, but can you give another introduction?
Yeah, happily. I had just tuned in for the last session and was listening to the conversation. So I'm Dominic Shattuck. I'm Director of Monitoring, Evaluation, and Learning for the Breakthrough Action Project at Johns Hopkins Center for Communication Programs. I've worked on and led several different vasectomy projects in Rwanda, scaling up vasectomy across the country, working on different social behavior change campaigns related to this, and was with Jonathan in his first World Vasectomy Day. I can't believe it's almost 10 years ago, and have seen this project evolve over time. And yeah, it's great to be here today, and great to know that this conversation is continuing as we, as Jonathan mentioned, we have these big global activities that oftentimes leave men out. And so I think we should visit that conversation a little bit today, this morning as well. So it's great to be here.
Well, I'm feeling very privileged as the only woman on this panel. So thank you, Dominic, and I agree with you about continuing the conversation. We're also joined by DJ Mose. And DJ, do you want to give us an introduction of you with a little bit of background for you, and then do you want to give us a little music?
Hey guys, nice to be here on the panel. First, good morning to those of you who are just waking up. Good afternoon to those who are sharing the same time zone, and good evening to those who are ahead of us in time now. As you heard from Beth, my name is DJ Mose, and I am in Nairobi, Kenya. I feel like I'm an outlier in these conversations because I'm like that kid, who's not part of this family here, but it feels like I've been adopted somehow here, and I'm glad to have met Peter Ngure sometime earlier this year. So I am a DJ by profession, and I did an organization that's called Kubamba, which is basically a youth outreach organization, and we basically reach out to young people that's between the ages of 14 and 25 in Kenya, just trying to sensitize, especially when it comes to issues of social responsibility. So I'm really glad to be a part of this panel. But also close to me when it comes to vasectomy is I am a proud partaker of vasectomy. So I went for a vasectomy about 2 years ago, and I'm glad I went for it. My wife is extremely happy I went for it. And Yeah, so thank you so much, guys, for for the invitation and allowing me to be here. Now, when it comes to playing music, or singing, I really can't do that. The meeting will just end immediately, Beth.
So no sampling from you today. Is that what you're saying?
I'll give you some samples, as we continue. I'll have something. I'll play something for you guys in the background. Yeah, that'll be good. I'll play something I've done before.
We are very early here in the United States, and
Yes.
I was hoping that would wake me up, but I'll rely on my coffee. That's fine. It's very fine. Eventually, I hope we will be joined by Dr. Moses Mwange, who is
Yes.
the leader of Samasha Medical Foundation, and while we wait for him, this session is designed to be much like the one before, it looked like, which is a free-form conversation between a number of people who have spent a lot of time thinking about vasectomy and working on vasectomy to make sure it's more mainstreamed and more available to people all over the world. So I don't know who wants to start. Peter, do you want to talk a little bit about your perspective on how we might increase the availability of vasectomy and counter some of the myths and misconceptions?
Yeah, thanks, Beth, and thanks to the team of Power.
And forgive me all, Peter, you're going to have to speak up as well.
Wow,
DJ Mose, you're perfect.
How is that, Beth?
You need to speak up just a little bit. Your volume is a little low.
Oh, I'll speak up and then I'll get the headphones in the next bit.
Okay.
Well, for us and having had this work around vasectomy, actually, I started working around vasectomy in 2014 when I met one of the professors from Hopkins who was doing a project in Kenya, and they were doing the GOATS project. And the idea was just to encourage men, just like we have done it for women, where we encourage women to come and give birth in facilities, and they are given an incentive like a goat or something to take home. And so in this country, vasectomy has been quite low, with looking at percentages of below 0.05 every year for the men who undergo vasectomy versus an MCPR of 58%. Meaning, women have beaten men by 57.5% in uptake of contraceptives, and that's just I think it's the biggest statistics that shows women are ahead of men in an aspect. And the question we keep asking ourselves is, why are men who should be 50% involved in their families 50-50, because as the law says here, then why don't they take family planning to support their wives? And the limited choice, of course, of men saying we only have condoms and vasectomy is a no-no conversation. First, because people have not had the vasectomy conversation, and it comes from a scaring perspective. Anytime you tell men about vasectomy, and I know we will mention this as we move in the conversation, men are scared because men think it would lead to erectile dysfunction and it would affect their manhood. But more as a researcher and an advocate, we've realized that also there's a huge gap in capacity by our health workers to offer vasectomy. And so we, about 3 months ago, I had a guy who wanted vasectomy, and I'm sure Tom will speak to this. But when they go to the facility, they are told you have to wait for a specialist who deals with vasectomy, who is not available. He works maybe in a Nairobi facility, and you have to wait for that. So there's a lot of issues that surround uptake of vasectomy. But of course, culture is one of those, but it has been mentioned. But I think more importantly, as we start the conversation, is seeing men as taking responsibility for family planning and speaking family planning as a unit, not only as a female planning. And I think that's where the conversation can start. What is the role of men in family? Are they part of the bigger family setup, or do they leave families for women only to manage? Thanks, Beth.
Thanks, Peter. I have a follow-up question for you, but thank you for muting everyone. My friend Hasrat, thank you for muting. So Peter, one of the things I want to ask you is how do you think we're going to overcome some of those barriers? I think that you're right, that it's already a hurdle to consider vasectomy, but then you have to find a provider, come in from wherever you're living to Nairobi, for example, and maybe that I've been to Nairobi many times. I don't know that I would want to brave the traffic even to come to get my vasectomy if I were a man. So what are you thinking about in terms of overcoming some of those barriers, and what are you suggesting and recommending? You're on mute. Thank you.
I think the first one would be advocacy for health institutions, and especially for our training colleges. There's limited or no budget at all set aside for capacity building or on-job training for vasectomy providers. And this actually is like the biggest challenge, where our providers do not have the courage or ability to provide the same. And it is also stems from underfunding of vasectomy permanent methods. Let me just put it like that, because even for BTL, the capacities of health workers to provide, there's no funding to keep training and keep building the capacity of our health workers. There's also limited awareness. When you discuss vasectomy, the conversation moves straight to issues around erectile dysfunction and what would happen if a man undergoes vasectomy. So there has been limited awareness, and I think awareness campaigns, just as Jonathan was saying, put just side by side with conversations around women uptake of contraceptives, be it the variety of method choice that women have had. We should have an advocacy conversation with an angle that shows that this is an additional to the method mix. And an additional to the method mix is a good thing, so that then we have a variety of people uptaking at this. And then thirdly, when we do the advocacy around giving men a goat around reproductive health, we are actually telling men to take charge of their reproductive health choices and their families. I always make this joke that a lot of men in this country of ours keep saying the reason why their wife or their girlfriend got pregnant is because they were trapped. And I tell them, you are not, there's no one trapping you or forcing you to get pregnant, for her to get pregnant. You are trapping yourself as a man. If you continue having sex, you know you have a variety of choices that you can take. You are not using any contraceptives. So you should take care of that pregnancy when you get pregnant. So there's quite a bit of awareness that is needed. There's quite a bit of research needed. And of course, funding for vasectomy. Just to finalize is that in Kenya, we now have the National Hospital Health Insurance Fund, which covers vasectomy and BTL. It's the only family planning method that are covered by insurance. So really, it is, even the government has taken that step to ensuring that the uptake is high. So it's up to awareness to men that is quite needed.
So Peter, I have one follow-up, and then we're a natural segue to Dominic from your remarks. But I have a rule in all meetings that if you use an acronym and you don't explain what it is, you have to make a donation to some very good cause. And I think it's a very good cause in terms of vasectomy services this time. So I'm going to give you a pass this time, but what is BTL for everybody who's on Facebook Live and thinking about vasectomy today?
Thanks. This is tube ligation, which is the female permanent method that is used to cut the tubes. And for my punishment, I will add a goat to our program.
Thank you so much. Dominic, it's a natural segue in the sense that the Center for Communication Programs and your work are very much aligned with what Peter is trying to do in Kenya, or suggesting that is done in Kenya. And I want you to explain a little bit about those kinds of efforts and what we need to do to scale them up more throughout countries that don't have access to vasectomy.
Yeah, great, thanks. And before I answer the question, I'd like to say it's great that the Kenyan National Health Service or health insurance program is actually covering vasectomy. Several years ago, a program in the United States, the Affordable Care Act, or also known as Obamacare, something we definitely need to expand and build upon in the US, it doesn't cover vasectomy. So I think it's a really important point to make in terms of how we view this as a service and as something that is viable and men will actually use. So it's great to know that that is part of the health insurance scheme in Kenya. One of the things is that, you know, working for the Center for Communication Programs, we do a lot of different outreaches. Right now, most of our work is focused on COVID because of the pandemic. I've had to shift a lot of my focus and attention to COVID-related programmatic work. But, you know, it's interesting to kind of see also in that, you know, kind of, I think, and I'm not going to go too far down this road, I'm going to focus on vasectomy, but I just need to say, like, men's health in general, whether it's COVID-related messaging or messaging around other health issues for men, is not really prominent among the different health messages that are promoted around the world. It's often taken for granted that men either will not show up at a hospital or a health setting, or that, you know, they're not the priority. And so, and not that they need to be the priority, but there does need to be a little bit more equity in terms of these messages. And this is a big chunk of the work at CCP, as we do a significant amount of work related to promoting different family planning options. You know, whether it's new methods coming out into a method mix in a given country, like a Kenya or Rwanda, where I worked significantly. But what's really important about also the promotion of family planning methods is that it's all about choice. And so when you think about choice and you want to message choice, you're messaging around kind of a lopsided circumstance where women have a significant number of family planning options, where they have, you know, many different types of IUDs. There are different types of pills that configurations of the hormonal components of the pills. There's also, you know, different things like the rhythm method and other kind of non-hormonal contraceptive methods that are available to women. And for men, you have condoms and you have vasectomy and abstinence. And so in that kind of messaging, it's important to figure out what is going to be salient with people and what resonates. One of the things we learned about vasectomy messaging from the work in Rwanda was that we have to be really careful about who that audience is. It is not 18-year-old men. They should know what a vasectomy is. They should know that this is something they can have, they can get later in their life, and it can improve their family and their relationship with their partner. But they're not your target audience for a vasectomy. Your target audience for a vasectomy is 35-year-old and older married men with 2 or more children. So let's when we talk about vasectomy, we talk about actually the prevalence of vasectomy around the world. We also need to cut the denominator out of this conversation, not just the vas deferens, but also the denominator out of this conversation. And we need to talk about that as what is the proportion of individuals who are within this target audience. It is, and again, just to kind of reiterate, married men over 35, usually over 40, with 2 or more children. And so that is really important in terms of messaging this, and making the messages salient is really another component, because these messages, vasectomies are not usually decided upon by a couple, by just the man. It's usually a couple making this decision together. And there are a couple of really important components to this. One of them is that when we did the work in Rwanda, what we learned was that the majority of men who came in, one of the main reasons and drivers for getting the vasectomy, you know, is obviously limiting family size. Another big driver for that vasectomy is that these men wanted to continue to have a sexual relationship with their wives. They wanted to continue to have a loving sexual relationship, but their wives oftentimes were, or most oftentimes were, struggling with the side effects of hormonal contraception. And so it's important to understand, like, when you think about what the messaging might be around that, you can also think about, like, the fact that many of these couples are struggling with something else, and they need an alternative. And this alternative, it could be the option for them. And so that messaging is really, really, I think it's really critical, getting those messages out. And I don't see a lot of that in our work. I don't see a lot of it, not just CCP's work, but I think the global public health messaging around around any contraception. And part of that is, like Peter was mentioning before, there's a limited number of vasectomy providers. but the awareness is just so low. And I feel like, awareness, as I should qualify that as, it's not just awareness. I think people know what vasectomy is, even in places where it's not available. But I feel like the awareness that this is actually a viable option for them is so low. And I feel like that's a big, big challenge.
So Dominic, I want to turn, do you have one more thing to say? I don't want to cut you off too. Okay, so I want to turn to DJ Mose. So you'll have to unmute yourself, DJ Mose. But does this resonate with you, everything that Dominic is saying? I especially appreciate the reference to couple communication and communication within couples, and just acknowledging that people are still sexually active even after all the kids and all the work and all the being tired. They're still in loving sexual relationships, and we don't talk about that at all. I mean, forget about what you're talking about, Dominic. I very much appreciate that you brought that into the conversation. DJ Mose.
Yeah, so I have to
resonate with you. Does this, when you made the decision to have a vasectomy, was everything that Dominic laid out true for you, or was it a different situation?
Yeah, so I have to agree with what Dominic has said, and it's important even for the guys who are watching us right now. And one of the messages that I try to pass on, since I came out that I have done a vasectomy, on all TV platforms or interviews that I've had, I've tried to make sure that you have to make a decision together, that it cannot just be the man who decides alone that he's going to get the vasectomy. But it's important, for couples to be able to come together and agree that, yes, this is the right decision for us to do as a family. Now, for me and my wife, that's exactly what we did. My wife was on the pill for the longest time. We got married 13 years ago, and so she had been using the pill for a long time. We have 3 kids now. And by the time we got our third born, we knew that he was going to be our last one. So, but the interesting thing that happened was when we went to the hospital and we met with the gynecologist just as we were getting ready for our last one to be born. The interesting thing was how he told us, okay, now if this is your last born, what you guys need to decide to do is, what are you going to do to make sure they don't get any more babies? But he stopped talking to us as a couple, and he turned away from me and just started talking specifically to my wife. I thought that was very interesting. So basically, I was not part of the conversation when it comes to family planning. But when we got back home, after my son, our last one is a boy, his name is Baraka. So when Baraka was about a year old, my wife said, Mose, I want to stop using the pill. This thing is not good for my health. It's messing me up, the hormonal change that I keep getting. So we need to consider what other options are available. The good thing was, just as she was telling me that, and we started having that conversation, one of my closest friends came to me and he told me, Mose, I just want to let you know that I've gone for the snip. I was like, what? So he gave me an opportunity to ask. His name is Andy. I was like, Andy, what do you mean you went for the snip? And so he told me what he did. And I was like, this is very interesting, because my wife and I were just talking about, what other options that we need to take so that she can stop using the pill. And so I called a friend of mine who's a doctor, just to find out what the process is like. When I called him, it was so funny because the previous week he had just gone for a vasectomy. And so he gave me the number for his doctor, and I was like, okay, at least he's a doctor, so at least it's easier for me to be able to go to the same doctor that he got to see. But for the people who are watching us right now, I just want to let you know that this is a decision that my wife and I decided to make together, because it's absolutely important. And I raise this because as I've been having conversations now with everyday people, you realize, that there are some men who decided to get a vasectomy prematurely without thinking about the consequences. And, they start asking, so is this reversible? And, it starts getting into complicated situations. And, in order for the men who are watching this session, I just want to say, to avoid that complication, just make sure that you are in agreement, that you know exactly what it is that you're going to do, because it's one of those decisions you definitely want to do, especially when it comes to family planning. And you don't get into a situation where later on you're trying to get kids. Of course, you won't get kids through the natural process of having intercourse with your girlfriend or with your wife. But so it's absolutely important that you have that conversation and make sure that you're both on the same page. Yeah.
Yeah, I'm glad that you brought up the issue of is it reversible?
Yes.
And I can tell you a little story, tiny story from my own personal life, is that my brother had a vasectomy after having 4 boys. He and his wife had four sons. And he really loves little girls. He thinks little girls are and he was very sad that he never had a daughter. and they never had a daughter. My sister-in-law and him never had a daughter. And so he asked me, do you think I should try and reverse my vasectomy? And I counseled him and we talked about it, and he decided not to reverse his vasectomy. One of the things I said is, you will someday have grandchildren. He now has 7 granddaughters. So he is very happy that he didn't reverse his vasectomy.
Yes.
So I want to now talk with Tom. Tom, can you unmute yourself and let's see if your microphone works better now?
Yeah. How does that sound? You can hear.
It sounds great. Just keep it right where it is and give us a sense. I know that you're considering getting a vasectomy, and you're very brave to come here, but you now have all the experts, or at least 3 of them, not me, who can help you with your questions. So give us a sense of your situation and what some of your thoughts are about vasectomy.
I will derive a lot of my conversation from my experience.
Tom, you're still going to have it closer. I'm sorry.
How about that now?
That's good. Just keep going and watch me. I'll tell you if it's not doing right.
Okay, sure. So my decision or my sharing will be mostly from my work around contraception and family planning, especially in the rural areas of Kenya. And so I will be sharing my things about this from a background that is mostly male-dominated, especially at the rural areas when it comes to issues.
Tom, you're still not. We still can't hear you very well.
You still cannot hear me. How about that?
That's good. Just keep coming close and speaking loudly.
Okay, so one of the issues which has been mentioned previously that I would want to contribute to as I come to my personal thoughts about vasectomy and what is advising my desire to be one of the beneficiaries or having undergone vasectomy is this. I think Peter has, DJ Moore has alluded to it. And I think as part of where we are heading to, we need to target women as drivers of vasectomy. Because when you as I am struggling with their decision, then we have what will our women say or partners say about this. So I really want to subscribe to DJ Moore's experience that really we need to target women as drivers of vasectomy. But that aside, some of the issues I'm struggling with is sperm count, ability to make a woman pregnant and produce a child, many a times in our setting defines masculinity. And whether or not you already have enough children, at the rural areas, that definition is you still need to be masculine. And that means the presence of sperms, okay, in your semen. How would how I wish I would want to hear from DJ Moore, how are you handling such questions and concerns around your masculinity versus vasectomy? And secondly, we have a lot of things catching up with us. Those side effects that DJ Moore was alluding to, and Peter is well aware of, on our women. Before we have our women settling down on 1 or 2 methods that work for them, you will hear I started with Depo-Provera, then I went to an implant, and then now I'm using a coil, or the coil is making my back ache, I'm having irregular periods and all this. And so this is catching up with us, and we have more of our women having different conversations around family planning. And this is magnifying what we want to call the misconceptions about family planning. So I think because this is catching up with us, it is the right time for us now to have that conversation and maybe have it our women as a push to that. And so for us to help our women grow better and possibly enjoy productive health, not for only recreation, I'm moving towards now supporting, and I want to undertake the vasectomy as a procedure, because we also need our women to enjoy the sexual part of them. They are not reproductive machines, they're not photocopy machines of our sperms and water. So I will need as much information, and I think what I want to hear mostly is then how do we get alternative compelling explanation to replace the myths that we have? Can we move away from negating the myths and possibly come up with alternative compelling explanations that are going to replace the myths that we have in our communities? I think that is the background I want to speak to, and possibly at a later stage, I would want to know how much do we pay and why do we even pay for it? Because to me, it seems a better option compared to the free services being offered to our women. Okay?
Mm-hmm.
In my community, we have people saying, oh, the Bible says, go ye and fill the world. But then I tell them, the Bible said you fill your own world, not the whole world. So my world is full. My world is full with the six children. So why do I still need them? Whose other world am I going to fill? Do I fill up my community, go to Kenya, and then go and fill the USA, and go to Canada and Europe to fill the world? So these are some of the ways I'm trying to struggle up with this in the community, in the rural community that I come from. And DJ Mo, I think I want to appear with you one on Bamba, and maybe we can have this discussion. Over to you. If there's any clarification I need to make, then I'll be happy to do that. But for now, I think those are my thoughts. Over to you.
That's great. And I think I'm going to take away the one quote from you and use it in my own remarks from time to time. Women are not a photocopier.
No, they are not. And women spend their lives, if they give you a child that is not looking like you, then questions are arising. Okay, it's like she is meant to give you a photocopy of you, but they need to enjoy their sexual life too. They need to have sex for themselves, not for recreation. Permission granted.
Hear, hear. Who wants to come in next? Anybody?
Let me say something first. Thank you, Tom, and I think it's a good.
By the way,
yes.
By the way, are we recording the session?
I don't know. Jonathan might be able to tell us.
Yes, we are recording the whole session. So we'll be able. We're going to send back to each organization a recording of their hour or their, the time they had. So you'll get to hear your quote played back to you.
Thank you, Jonathan.
All right, DJ Mose, give us some wisdom.
Yeah. So first, Tom was saying it's a good decision that you're making, actually. Especially for you and your wife, when you come to the place of getting a vasectomy. And I know that goes to the living decision.
I'll speak to that later, unfortunately. I'll speak to that later, unfortunately. That is okay. Please go.
Yeah. But it's a question, as you've been raising the issue of, masculinity, men here are viewed as real men because of the number of kids they can be able to have. I think that's toxic masculinity. We're not defined as men because of the number of babies we're able to have, because we also do have men who are not able to have babies for one reason or another. And so we need to educate the communities about what kind of men we want to have. You are a man first because of who you are, the way you are created, that makes you perfect just as you are. And so kids are a blessing. You don't do anything to be able to get kids for yourself. They are a blessing. And so we need to get to that space where we encourage the society not to have toxic masculinity, because it's actually very toxic. And especially for men who are not able to conceive or have kids. So there are other factors that make a man a real man, like being there for the community, being able to model the right values that you need to have. I have been in situations where in one of the interviews that I had in one of the local TV stations, and there was a lady who was with me on that interview, and she said, what if my husband wants me to have 5, 10, 12 kids, I should be able to be ready to reproduce the kids. And I said that's absolutely okay. But then at the same time, you need to look at, are you able to take care of your family? It's one thing to have babies, but are you able to actually take care of your family, take care of your kids, make sure that they're well nourished, they're able to go to school, and that your kids are not going to be abandoned because, you don't have the finances to be able to take care of your children. So I do think that there's a place for us to be able to apply wisdom, especially when it comes to issues of family planning. How many kids do we need to have, so that at least the kids that you have, that they'll be able to enjoy some good quality of life. Now, there is something that you mentioned about costs as well. And I think it's a good conversation for us to be able to have, because for me, where I went, it cost me about 20,000 shillings, which is about $200. That's a lot of money. It may not be affordable for many, for many Kenyans or for many men out there. But as you heard Peter saying earlier, Peter did say that the NHIF, National Hospital Insurance Fund in Kenya, actually does cover a vasectomy, which means the men can be able to go to the hospital and get a vasectomy, like in one of the general level 5 hospitals that we have. You should be able to go to the hospital and get that vasectomy. But we need to have more of these conversations, especially in our communities, so that we make sure that men or women are making the right choices. Because I think a big concern for me is that we have so many kids who are being neglected or who are being abandoned because their parents are not able to take care of them and be able to provide for them. But then also maybe it's because the dads and the moms do not know other options of contraceptives that are available or family planning options that are available, and vasectomy being one that's easily available for the men, but maybe they don't know that those services are available in the hospitals that are close by. I hope I'm making sense.
You are. Thank you so much.
Yeah,
We've
yes,
got it.
yes,
We've
yes.
got it. Tom, did you have something to say?
No, I was just confirming that, yes, DJ Mons is making a lot of sense with what he was saying. And I'll respond to some of these deliberations at a later stage.
Great.
Thank you.
Thank you. And we have Jonathan Stack with us, and he has thank you for being part of our panel. The floor is yours.
Well, I wanted to tell Tom that was a great quote. So I am also asking permission to requote. That's the first thing. Second thing is, I wanted to say that I know where you can get the best vasectomy in Kenya, and it would be free. So I will get you that information, and you can have, because the doctor was trained. He's been trained. We've worked with him on multiple occasions, and he's really excellent. I can attest to that. I've seen him work, and he's been trained by some of the best trainers in the world, and they all speak praises of his work as well. And he's based in Nairobi, and he works in Kisumu sometimes. So if you reach out to me, Tom, or you give me your email and put it in there, I will put you in touch with that doctor. So that's one thing. When you're ready, you have to make that decision. The second thing I wanted to say was that when we brought World Vasectomy Day to Kenya in 2016, and we ended up on the Maina Kageni show, which is the most popular radio show, and he talked about it for a long time on the show. We ended up with 135 million online impressions. There was so much action and energy around the topics. And it was interesting because the people who most engaged were young people, but they weren't talking about getting a vasectomy for themselves. They were talking about how do you negotiate your fertility with your partner. And that was, I think, is a really interesting, point, is like, it's the language you need, now if you're married and the vasectomy is the right choice at your point, but for a lot of people, it's really just about negotiating what to use when, who decides, how to make that decision, and to make that conversation part of something that becomes normal and natural, so that when the time comes, if it comes that you want to have a vasectomy, you already have the capacity to articulate it. And we're very happy about that. It didn't matter how many men got a vasectomy. What mattered was how many conversations were started. And I think there's a hunger for that conversation. And I think there's a lot of young people in Kenya, obviously eager to have it, because we were trending for like 4 straight days. It was quite amazing. And there were a lot of men who wanted to get vasectomies, which was an amazing experience too. But I just think there is the conversation is ripe to be had, and it's so important to have it. And it's great that you guys are starting it here as well. So congratulations to all of you.
Thanks, Jonathan.
Thank you, Jonathan. And I think yes, you can use the quote as many times as you want in any platforms. You can choose to tag me or not. And yes, I'm going to send you the email so that we start the conversation. And thank you for letting me know I don't have to go $20,200. Thank you so much. I'll start that conversation with you. So I'm chatting my email address.
You can get it for free, and you'll also get a free goat from Peter.
Oh, beautiful! And a show.
Back to the goats. I don't understand. We have some goat farmers here, and they think that's the best incentive for a vasectomy. So Dominic has his hand up. Dominic.
Just want to I want to get back to what Jonathan was saying, also Mose was saying, and Tom. This is really about conversations. This really is about communication between couples. It really is about, being able to articulate your goals, desires, and how you want to implement them. Now, one of the things we know from research is that the physician at Johns Hopkins, Eric Marcel, had done some research around boys in clinics around the United States that found that even up to the age of 16, 17 years old, kids who had gone into the clinic for various health services never actually had a conversation about family planning with their physicians. So all those missed opportunities to have that conversation about, thinking forward about your life as a reproductive person, being somebody who is responsible and an equitable partner. Those things are, and not that the physician is going to get into all of that, but it lays a foundation of awareness and understanding as to what you can do to kind of manage your own reproductive health. Whether it's sexually transmitted diseases, avoiding pregnancy, and being just a better overall communicating partner. And if you don't have that foundation, think about a man, and I will tell you from personal experience that until I got my vasectomy, until I went to the urologist, which is a specialized person to actually have this conversation with me, I think I was late 30s. I had never had a conversation about family planning with a physician in my entire life, except in my work. And so that is a problem. And that's a fundamental problem with the way in which men are engaged in the healthcare system. And so I feel like this is something that, when we talk about conversations, it is the conversation with your partner. It is the conversation with your parents, but it's also that conversation with the physicians and with the nurses and who the people are who are supposed to be caring for you as a whole human being. And so I think this is something that we need to kind of emphasize, it does kind of build and if you think about that, how much further along and how many different times have women articulated their reproductive intentions than men? And men, there's a big difference by the time they get to be 20 years old. And so we are taught, and the masculinity component to this is a whole other conversation, I have to say, but I would love to kind of have another hour on that too. But this is really important. Those conversations are key. And so sorry, I've been going a little long.
No, you're good. DJ Mose.
Yeah, I just want to, again, just a little bit more emphasis on what Dominic is talking about, because you do realize that we don't have many physicians who actually talk about vasectomies. And so one of the myths or one of the challenges that we have is people think that it's like you're going for a castration, or maybe it's a very painful process. And so because we don't have urologists or physicians who are talking about this, so there's a lot of misconceptions out there. And for me, a good comfort came in when my friend who's a doctor shared with me the urologist's number. His name is Dr. Charles Ochieng. Dr. Charles took me through the process, and he was like, Mose, this is such a simple process. It will only take you about 30 minutes. In 30 minutes, we'll be done. And, I drove myself to the clinic and I drove myself back home. And, level of pain, for those who are wondering, from 0 to 10, it was probably the level of discomfort was like a 2 out of 10. But at least I had the opportunity to get that information from the urologist and for him to walk me through what it is, what the whole process is. And so I do want to agree with Dominic that, these conversations need to come out more. We need more physicians, or urologists talking more about it so that the public is aware about what the process looks like. And, is it a painful process or is it not? So at least they can be able to bust some of the misconceptions that people have when it comes to vasectomy.
Thanks. I have a lot of hands, but I have a final question. We don't have that much time left. So speaking of conversations, there's a big one coming up next November. And this panel is sponsored and organized by the Gates Institute, but specifically focusing on the International Conference on Family Planning, which traditionally has focused on women's issues because, as for all the reasons that we've heard in the panel, this is your opportunity to give us your best ideas for how we could integrate male engagement, vasectomy, and some of the communication issues that we've been talking about up to now. what would be your one recommendation for the conference in Thailand, inshallah, next year in November? What would be your one idea for making that conference reflect the enormity of this issue and our conversation? Peter, you want to start?
Yes, thanks. And as I respond to that, I would just want to mention to Jonathan that yesterday in the launch of the FP 2030, there was mention of men and girls, because the vision is empowered men and women, empowered women and girls, and engaged men and boys. So there was a mention of men and boys, but the conversation of men and boys are actually just mostly ends at that. And so for me, going to ICFP, I'm looking at
another acronym, Peter.
International conference. When going to the International Conference on Family Planning, I'm looking at us highlighting more the importance of increased method mix, and having the conversation that vasectomy is part of the method. Because if you have right now, when you talk about method mix in a facility, they will not mention vasectomy as part of the methods. And so it's important for us to start now having and ensuring that that list includes vasectomy, includes male-focused family planning, so that then, and I think as this panel, and maybe Jonathan can help us, and Dominic has quite some good research, we can actually have a good panel at ICFP talking about men, because then they are users of sexuality, of sex, of intimacy. As 50% users of intimacy, how do you ensure that your method mix is right? And how do you ensure that your reproductive health rights is also realized? Because this is a reproductive health right of a man. When we talk about reproductive health rights, we are mainly focused about those of women. Men should also start pushing for their reproductive health rights and ensure that there is an increased method mix. I think that would be my take.
Thank you. Tom, do you have a suggestion?
Yes, sure. First, I need to get from you if you giving me a thumbs up or a no. You can hear me?
You're good. You're good.
Thank you. Now, I think for our conference, then right now I want to say I might be out of the picture, current data, but then I am here to come through even in the FP 2030 targets and commitments, a line that intentionally focuses on vasectomy as a method of family planning or as a contraception, for example, for in terms of male involvement. Which organizations are championing vasectomy? Do we have any budgets for that? So we have to be very intentional in the next ICFP in Thailand that this is now our commitment. These are our targets for the 2030 commitment from 1 or 2 or 3, whichever organizations. So that is one for me. We must have that intention and create targets 2030, especially on the line of vasectomy. Secondly, we need to have alternative compelling explanation to replace myths. We must not focus on the myths and misconceptions around vasectomy and talk about virility, masculinity. You lose your manhood once you are firing blank shots, in quotes. And we have to explain to our women and develop important messages which are going to be as sticky as the so-called myths and misconceptions. The myths and misconceptions are really sticky. They stick and get so much in the minds of the people who hear them. So we need to come up with compelling explanations to replace those myths. And lastly, for me, our women are the people who are going to drive our vehicle. If we target our women and explain to them why vasectomy for their spouses is one of the best things to keep their bodies healthy and away from hormones, for example, would be a very good thing. And I like to end there and thank DJ Mo. I think the pain is bearable. I underwent circumcision. I don't think it is as bad as circumcision. And Peter, thanks for the God.
Dominic, what are your thoughts quickly?
So a couple of things. One is that ICFP this year, so I think the first year that they had a male engagement track within ICFP, myself and Stan Becker were the co-chairs for that. And then it went away for a year for some reason. But this year it's back. And Logan, forgive me for not remembering his last name, from the Male Contraceptive Initiative, is leading that channel track within ICFP. So part of the ICFP conference will actually have this component to it. I think another kind of really interesting thing that could happen is, in the way in which people write abstracts for the conference. You write an abstract, and that is the thing that drives people to go to your actual presentation and listen to what you have to say. You could require those people who are writing up their abstracts to also include how does this presentation engage men, or what is the relevance to men in some way. To start making these researchers and these programmatic implementers to consider men in this context of the program. Did they actually engage men at all? Is it appropriate to engage men in this context? Sometimes it's not. But how does this actually, let's open that.